Welcome to the Digital Handshake podcast. I'm your host, Scott Jorgensen, and I'm pleased to be here with Dr. Cindy Wu from Charlotte, North Carolina, or the impressive HKB surgery clinic there that's basically taking over the Mid-Atlantic. Dr. Wu, pleasure to have you on the show.
Scott, thank you so much for having me on the show. I'm really excited for today's conversation.
Excellent, excellent. Well, let's get started. I understand, you've been a plastic surgeon for some time. You've been there at HKB there in North Carolina. We were just chatting. You trained as an aesthetic fellow with Dr. Grotting. Introduce us to Dr. Wu.
So, I am a plastic surgeon and I'm double board certified, which means I'm boarded in both general surgery and plastic surgery, but I practice plastic surgery. I love what I do. I think it's the greatest job in the world. I love coming to work. I don't know if that sounds cliche, but I really do. And the thing I love about being a plastic surgeon the most is that I'm able to make people happy and confident through what I do. I am really into art. I love science. And, I went to school to major in both. And I think that plastic surgery just became a perfect marriage of both. And patients that I see are very unique. Like they have individual anatomy, they have individual goals for their aesthetics, and really just honing in and finding what that patient really wants and what their body can, how it can transform to what they want is really a challenge. It's constantly like very intellectually stimulating. And, I think it's great to be able to do that and make patients happy through plastic surgery. So that's what I love about plastic surgery.
Well, if you weren't so smart and you didn't do so well in school and didn't have a passion for medicine and love for patients, and for whatever reason in this life you didn't become a plastic surgeon, what would you have become?
Oh, that's a good question. All right, my other loves are I love to eat. I'm an adventurous eater. Trying different cuisines in different restaurants. That's kind of my pastime. So I might have been in the food industry somehow, either as a chef or maybe what do you call it? Like a food critic. So I can be able to go in and like taste different foods and travel the world and see different cultures. That's probably what I would have done.
Yeah, well, you and I share the same passion. I definitely love to eat, love to go out to restaurants.
Do you have a favorite food?
Mexican food, hands down, hands down. Yeah, like,
Nice.
yeah.
Yeah.
Chips and salsa, that's a problem for me, big time.
Yeah, me too.
Okay, well, let's talk about the practice. In particular, what's your specialty? Are we, above the neck, below the neck? Kind of where's your focal point?
Yeah, I'm a breast and body plastic surgeon. That's where I love to operate. That's my focus. That's my passion. And it's really where I love to be. And so I've had colleagues who do the facial aesthetic surgery, and I just prefer to perform breast and body surgeries. So my practice is 100% aesthetic. I see patients from, age 18 all the way to 75. I have a wide range of patients, mostly women, and then I have some men who are seeking plastic surgery. In addition to the surgical procedures that I offer some injectables. So I do facial injections, body injections are becoming more popular now. So people who want better skin quality on their lower extremities, on their buttocks, or if they want more volume on their buttocks, that is something that we are doing more and more of. So a combination of surgical and non-surgical. And I'm in actually two locations in North Carolina. So HKB has locations across 6 states now, and I'm at two of them. I'm in the Chapel Hill location and also Greensboro. So they're about an hour apart, and I split my time between those two practices. And it's been amazing because I get to meet people in Chapel Hill and also Greensboro. So it's kind of widening our area that we can serve for patients.
You had mentioned sort of primarily a female plastic surgery practice in breast and body. GLP-1s, peptides have become sort of in vogue, right, for weight management. I think those patients perhaps 5, 10 years ago may have opted for perhaps surgery, maybe even liposuction to manage that in terms of just weight and fat and what have you. Talk to me a little bit about that patient in particular now that we've got these new products like, these peptides on the marketplace that folks are opting for versus surgery.
Yeah, so I'm seeing a lot more GLP-1 patients. In fact, it's so common now that part of our screening, one of our screening questions when patients come in for a consult is, are you on a GLP-1? Because we need to know that. These patients are of all different ages, men and women. And so what happens is you lose a lot of weight with this GLP-1 medication, and then you have a lot of extra skin, basically everywhere. So patients come in for facelift, they want an arm lift or a breast lift with or without implants, and then a tummy tuck or a thigh lift. So really, we're trying to tailor their skin to the smaller person that they are now. So the analogy I like to give people is if you're going to fit a wedding dress, there's not just one fitting for the dress, but you have multiple fittings. And you can imagine that after you've lost weight with GLP-1, you're trying to fit a smaller body in multiple areas of your body. So it's going to take more than one surgical procedure to get you there. And that's one thing that I really counsel my weight loss patients on is that this is a journey. You and I are going to go on a journey together because we can't do all of your surgery in just one go. It needs to be staged. And when I'm in a consultation with the patient, I ask him or her, what is the part of the body that is most troublesome to you? You know, what's the most concerning area? And we address that area first, typically, because then patients are happy. They see improvement in that area that's always bothered them. And then we can go to subsequent areas. So, and everyone, like I said, is very individual. So we can combine surgeries based on what their goals are and what their anatomy is.
So talking a little bit more about that aesthetic patient in particular, we'll say the female aesthetic patient, and how that's evolved, say 5, 10 years ago versus today in terms of their desires, their interests, their concerns. For example, we've got GLP-1s now on the marketplace. We've got peptides. I think the aesthetic, woman, active woman, if you will, is more into fitness, more into weightlifting, more concerned about, sort of this natural aging versus, sort of this overdone look, what have you. Talk to me a little bit about how you've seen that evolution in your practice.
Yeah, this is a trend that I've been seeing in my practice, and the emphasis on a more natural aesthetic. And like you mentioned, women are more athletic, they're really concerned with their health, and it's really become a form of self care to have plastic surgery. Whereas I think before, maybe 10 years ago, people thought it was more of a luxury, but now it's more commonplace. And so people are wanting more of these procedures. And so a lot of patients I'm seeing, like over the past 5, 10 years, they are active, they're professional, and they want procedures that don't give them a lot of downtime. And I think the procedures have developed to meet that need. So there is a more minimally invasive way to do breast augmentation, for example. We are now seeing women who want to go above the muscle so they don't have compromise of that muscle function when the implants go underneath the muscle. And women don't have the typical 4 to 6 weeks of downtime that they maybe could have afforded before, like 5, 10 years ago. Now women really want to go back to work. They have kids, they have a life, and they want to go back to being active. So, women are really wanting a more natural aesthetic. So in breast, that means not a very large volume implant or not like a very voluptuous look, but more natural look. And I'm sure you've heard of the term ballerina breast.
Right.
And that is just a term that refers to a more natural aesthetic. And I think that also applies to the body, with if you're talking about weight loss patients, they want a natural contour of their arms, of their tummy. And I see that. I see that every day. That's what people want. And it's interesting too, while I'm talking about the tummy, in the past, when you look at tummy tuck results, they are flat. There's no contour. There's a bikini line incision and then maybe an umbilical incision. But now what we're seeing more of is allowing the body's contour to really shine. And what I mean by that is that, you have valleys and you have shadows, and then you have contours of the abdomen you want to maintain. And so I think the techniques are evolving to reflect the fact that you want to show the natural anatomy. You don't want to have just a completely flat abdomen because that's not natural. You need to be able to see the six-pack muscles, the sides, the external oblique definition. So all of that is really kind of evolving into how we are creating an aesthetic for a natural result.
So going back to breast augmentation, you had spoken about sort of this trend for a more, we'll call it over the muscle, subglandular approach
Yeah.
to breast augmentation. And What are some topics that you wish women that are considering that procedure that you feel that are important that for whatever reason aren't being explored, whether it's on social media, whether it's through education? If you had a chance right now, like to better educate those women that are coming to your practice seeking a consult that you wish they knew.
I think it's important to really tell patients how an augmentation can affect her function. So, for example, when you do a submuscular augmentation, you're putting the implant under the muscle. And historically, that's been done with really great results and really long term safety data. And in terms of the muscle function, though, if you're really active, that can weaken your pec function. There are some surgeons who recommend that you modify what you do in the gym if you have a submuscular implant, namely not doing isolated pec muscle exercises like a wide chest press or just a wide chest push up. So things like that can affect your function if you're really, really active. And so women are now more cognizant of that. And so they're choosing not to have that kind of submuscular implant if they want to still maintain their function, if they're really strong in the upper body. And so I think they're more educated now, and they're coming in choosing the above the muscle. And now above the muscle is not good for everybody because there's some patients whose anatomy best plane to put the implant in. For example, if you're thin or if your tissues are a little bit more saggy than others, then that might not be the best plane for you. But some women, it's a better choice. And
Yeah.
so I think knowing what that does to your function is important because I think a lot of women may go on social media and may look at the implants and look at it from an aesthetic standpoint. But it's my job as a surgeon to educate patients not only about the aesthetic result they can have, but what that means for their functional quality of life afterwards. And so I'm trying to find the perfect balance of giving her what she wants aesthetically, but also maintaining the lifestyle that she wants to have.
Yeah, I love that. I love that sort of approach of being able to deliver a optimal form, right, while
Mhm.
preserving the function
Yeah.
of sort of the body and the muscle and the lifestyle as well. Thinking more about patients, and we had talked about being part of HKB and how HKB is growing, and it sounds pretty exciting to be part of this. Really what I feel is kind of one of the juggernaut plastic surgery groups out there in the U.S. How are we finding these patients, or how are patients finding you? You know, the focus here at the Digital Handshake podcast is really about helping plastic surgeons, create that digital handshake with their patients, right? Presenting that sort of best impression online and talk to us a little bit more about sort of how are you accessing social media? How are you accessing whether it's local SEO or other types of marketing formats to find these patients and convert them to your practice?
Yeah, that's a great question. It's been an evolution. So I've been in the area for over 11 years now. And I think just being here in Chapel Hill, getting to know the community, people know what I do and they come to me from that standpoint. And then as I'm building my practice, of course, word of mouth referrals is very powerful. So patients come to me that way. But in terms of the social media presence, it's something that I had to kind of grow. So I started with oh gosh, it was a personal Instagram and a personal Facebook. And then I decided to build a professional page on both platforms. And initially, I was kind of like probably most people, just feeling my way around the social media landscape and not really sure what to post on my personal versus business. And it was I felt like it was kind of a guessing game initially. I would see what people would post and I thought it was really good. And I would try to emulate that post. But really, it took a course. I actually had to take a course on social media and how to post, what to post, when, what things are going to be viral and, how to come up with your brand pillars. And it really helped me focus what I put out on Instagram, which is now my main platform. And it really got me to think, okay, what are the things that I want to say to the world, to my patients? And I really had to do some soul searching and I came up with three things. I wanted to put forth authentic advice because there's a lot of stuff out there that's just it's not true, it's sensationalized, and I really just wanted to give an authentic voice to plastic surgery. All right, so that was the first thing, and also give expert expert insight. So what do I think about these procedures, or what is the best thing for your recovery, or why do we do this procedure versus that procedure? And so really giving an opinion on plastic surgery and just, the landscape. So expert insight into things, and then a behind the scenes look, because people really want to know, okay, what's going on in the OR, or what's going on in the clinic, or what does she do on her day off? Does she spend time going to the movies or going out to eat? So I think nowadays patients want to know what your plastic surgeon is like outside of the office. So they want to know personally who you are, because not only do they want to vet you and make sure that you're qualified and you're an expert, but they also kind of want to like you. You don't want to go to someone who is going to see you naked, operate on you, change your body image with someone that you don't like and that you're potentially going to spend a lot of time with. So they're doing their research in that arena too. And I think it's great because it humanizes us as more than surgeons. I mean, I'm also a mom. I have kids. I also have to do daycare drop off. They wake up in the middle of the night, like all those things. So we have a shared common experience, my patients and I. So I think that just creates a stronger bond. So social media is a way for me to reach my patients, to kind of give them a glimpse into what a plastic surgeon does, but also what a mom does, what a wife does.
Yeah.
And just kind of the day to day, how we're very similar in that aspect.
I love that. If I could recap. So Dr. Wu's 3 pillars of social media, speak the truth, right?
Yes.
Be authentic, but also offer an opinion, take a stance, right? Provide that vantage
Yeah,
point. And then
exactly.
lastly is be yourself and let your patients see who Dr. Wu is both in and out of the practice.
Yeah, absolutely. I had to really develop that because initially I was just kind of, making it up as I went along. But along the way, I think I've been able to hone those things, what I want to put out there.
Well done. Well done. To wrap up here, what I'd like to do is just play a little bit of a game with you, if that's okay.
Sure.
Couple quick questions for you, kind of like what's hot, what's not in plastic surgery. Give me your stance on it. And again, this is kind of going back to one of your pillars, which is, hey, I'm going to offer my opinion. We're going to jump into it. Let's see here. Preservation breast augmentation. Is it a fad or is it the future of breast augmentation?
I think it's the future. So it is a way to do a breast augmentation that's more minimally invasive. So the concept behind it is that you're preserving the breast tissue and just parting the breast tissue just enough so you can place the implant. And so the concept is that you're nesting the implant in the breast. And because you're doing that, you're able to recruit or shore up some more of the breast volume so that the additive effect of the volumization is actually greater than a traditional breast augmentation, where you're separating the breast tissue from the muscle. And so the volumizing effect is a little bit more, meaning a smaller implant can give you the appearance of a larger augmentation compared to the traditional breast augmentation. It's also less anesthesia, which means that there's less hangover when you wake up, and basically you're less groggy. And this is for the patient who wants to recover quicker. So recovery can be 2 weeks of no lifting compared to a traditional breast augmentation, which is typically 4 or 6 weeks. So it's really designed for the woman who wants a smaller augmentation, is busy, can't afford the downtime, and it's just, a more refined way to do a breast augmentation. Not every woman is a candidate for Preservé because you have to have a certain anatomy. You can't want a large augmentation because the biggest volume size is a 315 cc implant. So it's really for a specific type of breast augmentation patient. But the analogy I like to give is we know how to do open heart surgery. That's a surgery that's been, developed for years, and it gets the job done. But we also have coronary stent surgery that you can do through a radial artery or through an artery in your groin. So I think that's kind of the analogy between traditional breast augmentation and Preservé. It's a refinement of a wonderful technique we already have that a lot of women are a candidate for, just refining it a little bit to a specific type of patient. So I definitely think that is on the horizon, actually here, and gaining more traction with patients.
Great. We'll go one more.
Yeah.
Regenerative aesthetics. So talking about sort of exomes, fat, et cetera. Is that the future or is that false hope?
Absolutely. I think both are the future. So, regenerative aesthetics, I think using your body's own capability to make collagen and to make elastin is really the future of aesthetic medicine. And also fat transfer, too. We know that fat cells have an element of stem cells in it, which can help with overlying skin quality and skin texture, in addition to fat's ability to be a volumizer. So those two things really have hit the scene and really taken off. I think more and more research is going into the regenerative aesthetics, so exosomes, biostimulators, and expanding their uses. And same thing with fat. We are developing ways to better purify fat and finding other areas where people can benefit from fat transfer. And all of that goes back to the drive for a more natural aesthetic for patients, using your own collagen and elastin to look more refreshed and youthful, and using your own fat tissue for a more natural contour. So I think it all fits within the current trend of being more natural.
Well, thank you so much, Dr. Wu, for sharing your perspectives and your insights with us here on the Digital Handshake podcast. And we want to thank our sponsors, Media PSC, for making this podcast available. And again, Dr. Wu, it's been a pleasure, and we look forward to having you on our next episode.
Thank you, Scott. Pleasure to be here.